Can you say hi? He's got your shirt.
Yeah. Welcome to Teen Tad. Straight out of cardiac ICU.
Yeah, you want to play with your dad's shirt?
Today, we will be doing a trach change and walking you through it.
Not walking you through it.
Kinda. Just
Showing you.
Showing you the fun parts.
Bringing you along. As always, because we're sharing something medical, we are just putting it out there that we are not medical professionals. Everything that
we're not getting paid for this.
Yeah. Everything that we know, we've just been taught by Tad's nurses and learned.
Picked up along the way.
Yep, on our own. So if you have any questions that are serious, any questions at all should really be asked.
We can answer things, but it would be better to go to somebody who gets paid for this.
Go to medical professionals for any questions or concerns about anything trach related. This is just kind of sharing how we take care of Tad.
What we go through to take care of him.
And people are always kind of interested in like what goes along with the care. So today we're going to kind of show you.
He doesn't stay still for that either.
Yeah, it's a little bit harder. Well, it's harder and easier in different regards. So when Tad came home, he was on the ventilator, so it was harder to change his trach then because it was like not just changing a trach, but like changing a trach and a circuit.
Well, he was also much more dependent on it back then too. Mm-hmm. You had to be real quick with it. Now you can take it out and he can, if he's relaxed, he'll be fine.
Yeah. And then also just to go kind of with that, we're taught to do it with two people, but when you get home, you kind of realize like not all the time is Tyler available to help me change his trach. So
you don't always have the other person. It's vice versa.
Yeah, but mom's here all the time, is what I was saying. So normally this is to be done with two people. Today, I will just be doing it, and Tyler's going to be filming. Man, that really hurt. Did that hurt you? So, hope you enjoy coming along. So this is just kind of like a simple breakdown of what everything is. My hands are sanitized. This is the actual trach. We're going to keep it in here to keep it clean. And this is the operator. It just creates a little bit more stability when putting it in. Oh, coming for some more saline. This is to inflate and deflate the balloon or the cuff. Sterile lube to lubricate the trach. This is the trach tie that I'm going to cut to fit his neck. Whoa, whoa. Here, you want to come over here and help me? Oh no. And then we've got Q-tips to just kind of clean his stoma after we're done. One dry split gauze, another one to put, and a wet one. Okay, so Tad's trach is a cuffed trach, which just means that it basically has this little thing hanging and that this piece right here can inflate. So he is cuffed, but it's deflated. So just in case if we ever were to need to use his balloon or his doctor's, we always test to make sure that the balloon still works. So I'm just putting, there's just air in this syringe, and then it will inflate. So this is just to ensure that the balloon works, but because we don't need that, and if he was to have an inflated trach, we would always deflate it first. So then you'd place it and then inflate it when it's in his trachea. So there's that. And then we will, on the trach that he has in, even though it's deflated, we're still going to pull back and make sure there's no air so that when we take the trach out, it doesn't irritate him. Then next, this is just sterile lube to make the trach go in a little bit smoother. So again, this whole time I'm doing this, I'm not touching the actual trach because this is going to go inside. So then this trach is ready. Now this is how long the actual trach tie comes in, but Tad's size is not that big. So then I'm just going to cut off all this extra. And then this is Tad's size. I've changed his trach tie so many times I know his size, but sometimes people will place it on first and then cut. I just find it's easier that way. So now I have everything ready here. So I'm going to lay Tad down. Okay, so here's our little model. Right now he's wearing his speaking valve. So I'm going to take this off before we do the trach change, just to kind of make it easier for him. So all this does is it forces him to breathe in through it, but air cannot come out of the trach. So it's forcing him to
cough out his mouth right now.
Breathe out of his mouth, which makes him use his vocal cords, which is why it's called a speaking valve or a pacemaire. So we're going to take this off. Do you want to put it in the cup? Do you want to put it in the cup? Thank you. Yeah, we're all done with it for right now. Okay, and then just like I said, we're going to actually use this. Can I borrow this? And we're going to make sure that there's no air coming out of his cuff. He has destroyed his cuff because he chews on it. So nothing's going to come out, but just to make sure it's fully deflated. And then now I lay him over my foot just to kind of make a little bit of a neck roll for him so it's easier. And then all I'm going to do is cut the ties off the sides and then take the split gauze off and then take this trach out and replace it. Okay, so I'm just using these scissors to cut the Velcro pieces off. Hold on, you gotta stay still for just a second. What'd you just put in your mouth? Yeah, you better take that out. No. Trach tie changes with a toddler are fun. That's a good way to put it, huh, Tio? Okay, so this is off. It's a trach tie. Split gauze is off. So now he just has his trach in. So I found that sitting him up is actually nice now that he's a little bit older, so I'm going to go ahead and sit him up. Okay, going to turn you towards me. Ready? Yeah? Okay, can you take this out of your mouth? Yes, please. No, spit it out. Okay, you gotta look up. Look up. Here you go. No, we can't touch that. Okay, all done. So that's it on the trach tie zone, or the trach change. So now I'm just gonna clean around. I'm gonna lay you back down. So now I'm just wiping any extra sterile lube that would have gotten on the outside, and then I'm just gonna take split gauze that has saline on it and wipe around. You okay? You got a tickle in your throat? I know, that's your old one. Oh, good job. You gonna put the obturator in? Yeah, you gotta tilt it a little bit. You got it. Good job. You showing everybody too? You're very drooly. So then I'm just gonna dry it. I know I'm tickling your throat. And now I'm just placing a piece of gauze in between his trach and his neck to prevent any irritation. There's that. And now trach tag goes in. And around. And Velcro's on the other side. You think it's so funny? And all done. Do you want to put your speaking valve back on? He is all done. Not so bad. Everybody asked, does it hurt him? And yeah, I'm sure it's not comfortable. But you could see he recovered very quickly afterwards. So then this trach is actually going to get cleaned now because it's dirty. We're going to have to go wash your hands. But even Tad, you could see the reason why we use this obturator is... Hold on, can I see it for a second? Okay, he doesn't want to show me. But this piece is actually very flimsy. And then the obturator, when you place it in, he does not want me to touch it. Gives it a little bit more stability to actually guide it through. Are we all done? Can you say all done? You don't want to say all done? Trach changes did not always look like this for us. During the beginning it was a big orchestra of getting everything perfect and being kind of anxious of it, but at this point now we've been home with Tad for 2 years doing trach changes by ourselves, so it's kind of easier now. But hope you enjoyed.
Can you say bye-bye?
Can you say bye-bye? Can you say bye-bye? Bye-bye.
Kinda.
Okay, so we filmed Tad getting a new trach, and then I asked on my Instagram if anyone had any questions, and we got a few questions, so we're going to answer them now. So question number 1 is, why does Tad have a trach?
He had something called tracheomalacia, which is where the cartilage in the trachea hadn't completely strengthened yet, so basically it would clamp down and he wouldn't be able to breathe for, I don't know, minutes until we bagged him and got it back open.
I don't know if it was minutes.
I mean, he wouldn't have been able to do it on his own if we didn't.
Basically, your trachea is supposed to be open, and his would close, which is normal, but it wouldn't reopen again, so then he would not be able to get air in or oxygen in.
We'd have to force it in with a bag.
A bag, yeah. Have to forcefully open his trachea.
We didn't find out about it for months, and I think it was 4 months, right?
Yeah, Tad got his trach when he was 3 months old and a month before his Norwood.
Oh, that's right.
So we didn't find out about the tracheomalacia until he was about 6 months old.
They thought he was having cardiac problems, or they didn't know what to do.
Yeah, so reason why Tad has this trach is he was having issues with his airway. So when he was little, he had his first open heart surgery when he was 3 days old. So those first 3 days he was breathing on his own, but he wasn't really put in any situations where he was tested. So we don't know if maybe he had tracheomalacia even before his first surgery, but then when we tried to extubate or remove the breathing tube, he just was never able to do it all on his own.
We tried it all the time.
Yeah.
And finally they decided to let him go how long he could, show how long he could go, and he went, 17 hours?
Yeah,
yes.
But I noticed that his fingertips were kind of blue, and he just looked like he was kind of struggling, so, whoa! At that point, sorry, the dogs are being crazy. At that point, we just kind of decided that, he already was having so many cardiac issues, we didn't want to put any more pressure on him. So, that's why he has a trach. The reason why he still has a trach, because right now he also went home on a ventilator, oxygen. He wants mom. he really needed the trach at that point because he needed extra respiratory assistance. Blah, 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 blah. But now at this point in his journey, if we didn't have upcoming surgeries, there would be a possibility we would be exploring getting rid of the trach earlier, but because he has future open heart surgery,
he has to be
don't
intubated
want
again,
it. Yeah.
and he has a lot of scar tissue, and if they were to intervene and do anything to his trachea right now and then damage it again with the next surgery, that would be pointless. So basically our ENT wants to wait until all the surgery's out of the way and then see where we stand as far as his trach looks. And if it's open enough, we can try to move towards getting the trach out. And if it's still nasty looking with scar tissue, then he'll have to rebuild it. That's what it is, though.
I know, but it's just so in depth, and honestly, it's.
We're explaining to them what's going on.
I know, but it's like hard to explain in a way that actually like can make sense. You may not understand him still. Anyways, basically, he still has the trach right now because he has scar tissue. So because he was intubated so many times when he was little, it created scar tissue, almost like calluses on your fingers inside of his trachea. So it just puts him at more of a risk of having breathing issues. So we just don't really want to risk it with that. So he still has a trach. Hopefully, the next question is, will he have to have his trach forever? And no, we're planning on after his last heart surgery, which we got somewhat of a estimated date when he was about 4 years old. After that surgery, you guys are crazies. After that surgery, we will start to explore getting the trach out. There is steps that are needed in between now and getting his trach out, which is like wearing the pacemaire, which if you follow our Instagram, you've kind of seen him like all of a sudden start making noises, which is because of the pacemaire. And then he'll go into a cap, which is essentially making him breathe out of his mouth and nose even though the trach is there.
It closes the trach off altogether.
Yeah. So it kind of like forces them to learn what it's like without the trach there. So there's still steps that are needed in between.
But we're getting there.
Yeah, he's doing great. But yeah, the whole trach, like explaining it is pretty complicated.
If you have questions, ask. We may not be able to answer all of them, but we can help. Kind of.
Well, I don't know about
describe
help,
what was going on.
But yeah, we can try to explain.
There was another question. Cuffed.
Oh yeah, so somebody who asked this question probably knows about trach. So they asked, why does he have his trach cuffed, or why does he have a cuff? And if you look on, you'll see him sometimes like chewing on this little. It's like a balloon. And the reason for that is when he first got his trach, he was on pretty high vent settings, and so in order to make the vent work,
it wouldn't leak out if the balloon was inflated inside.
So the way the ventilator works is
here.
it pushes air into him, and if he had a big leak, so it would not be as effective.
It would just go in and go right back out the hole in his
stoma.
Yeah.
But by cuffing it, it creates a sealed circuit.
It pushes a balloon open, so it forces the air down.
Yeah. If that makes sense. But whoever asked that is asking because they obviously know something about trachs. But that was all the questions we got. Hopefully you enjoyed this video. The trach is kind of complex. It was a lot for us to learn.
Chewing on it now.
So obviously trying to reiterate what we've learned is also kind of hard, but
it was very important for Ted to get it though.
Yeah.
He wouldn't have been able to do any of the things he's done today if it wasn't for the trach.
Yeah. So
we're very thankful for it, and as much as it's made a lot of things more difficult, it's made a lot of things much easier, so.
Yup. And thanks for watching. See you next one.